Welcome to the Medical Intensive Care Unit 2 or MICU2. Patients will be admitted to the MICU2 when they have a serious illness that require round-the-clock specialized nursing care and critical care. Patients are admitted to MICU2 when having respiratory failure, circulation failure, septic shock, acute kidney injury, massive upper gastrointestinal bleeding or UTIB, and so on. These conditions need intensive monitoring or supporting, as well as medications using or procedure implementing. Staff at the intensive care unit include doctors, registered nurses, and nurse practitioners. Each of us is trained to provide the advanced critical for ill patients, and each of us has a unique job and responsibility. For one registered nurse takes care of 2 patients, and we provide our service for 24 hours a day and 7 days a week. There are so many kinds of medical equipment and therapy. For example, ventilator, the vital sign and EKG monitoring, arterial line, Foley's catheter, OT and NG tube, plasmapheresis or TPE, continuous renal replacement therapy or CRRT. Ventilator is used for the respiratory failure patients. We can monitor the patient's heart rate, blood pressure, respiratory rate, pulse oximetry by using the equipment for the vital signs and EKG monitoring. Arterial line, which is a thin catheter inserting into artery, is used to monitor blood pressure and take blood for arterial blood gas analysis. Foley's catheter, which is a thin sterile tube inserting into the urethra to drain urine. Oral and nasal gastrointestinal tube, which is a flexible tube, is used to provide the nutrition and medicine when the patient is unable to eat. Plasmapheresis or TPE is used in critical illness patients who have a microvascular thrombosis or patients with autoantibodies. Finally, the continuous renal replacement therapy, or CRRT, is used to deal with the severe kidney injury, renal dysfunction in AKI, severe sepsis, and septic shock. The routine care at MICU2 include pre- and post-conference, coordination with other healthcare professionals, and close monitoring of critically ill patients. Nursing intervention include recording vital signs every hour or every 15 minutes, taking medicine, injecting drug, taking blood, recording intake and output fluid, transfusing blood, resuscitating IV fluid, dressing wound, suctioning, changing position, completing bed bath, feeding, early ambulation or early rehabilitation. When our patient gets much better, just as having stable vital signs, hemodynamic, and neurosign, most of them will be transferred as step-down unit or semi-ICU in hospital. For example, IMC 4B, 4A, and 4C. Thank you for your attention.